When you wake up, have you ever noticed that your body feels different? It could have been losing weight quickly, feeling a strange pain that wasn't there before, or waking up drenched in sweat for no apparent reason. What if I told you that some morning symptoms could be your body's way of sounds, the alarm, letting you know that something bad like cancer might be starting to form? The truth is that most people don't pay attention to the small signs their bodies send them because they think it's just part of getting older. If you don't pay attention to these signs, you might miss the chance to catch something early and treat it. In this video, we'll look at 4 important signs that doctors say could mean you have a high risk of developing cancer. These might surprise you, and some of them might be things you've seen in yourself or someone you care about. However, after watching this video, you'll know how to spot these red flags and most importantly, what to do next. Listen all the way to the end to find out how these symptoms are linked, why they're important, and what you should do if you have them. This information could save your life. Before we start, make sure you subscribe and hit the bell button. You won't miss a video that way. Do you like this video? Feel free to leave a comment if so. In the comments, type 0 to tell me you don't like it. It will help me make better videos for you. We can start now. First, a cough or hoarseness that doesn't go away. An ongoing cough or a hoarse voice that doesn't get better can also be a big sign of cancer, especially in older people. Coughing that lasts for weeks or months could be a sign of something more serious, like lung or throat cancer. Coughing that lasts for weeks or months is usually caused by a cold or seasonal allergies. Cancers of the lungs, throat, or larynx are often linked to this sign. For older people, this symptom can be especially scary because it's sometimes mistaken for a common cold or flu. But if the cough lasts for a long time and gets worse over time, it could mean that a tumor is blocking or pressing against the airways, making it hard to breathe and causing the cough to last. Also, a hoarse voice could mean that a tumor is affecting the vocal cords or nerves in the throat. This can be seen in George, a 72-year-old man who had a dry cough and a hoarse voice for a few months. At first, he thought it was just a cold that wouldn't go away, but the symptoms didn't get better. An X-ray taken when George went to the doctor showed that he had a tumor in his lung that was pressing on his vocal cords and airways. It's too bad that this condition had gotten a lot worse by the time it was diagnosed. It's important to not ignore the link between a cough that won't go away and lung or throat cancer. It's important to see a doctor right away if you have a cough that won't go away, trouble breathing, or changes in your voice, especially if the symptoms last for more than 3 weeks. Do not wait for the symptoms to get worse before getting help. Early detection can make a big difference in how well treatments work. Second, getting tired in the mornings that doesn't go away with rest. Getting up in the morning should make you feel better or at least more refreshed than when you went to bed. But if you wake up feeling just as tired as the night before, or even more so, it might not have been a bad night's sleep. Doctors warn that being tired in the morning, even after getting enough rest, can be an early sign of cancer. Being tired because of cancer is not the same as being tired in general. What I'm feeling is so tired that sleep and rest don't make it better. When you feel this tired, it's likely because your body's using its energy to fight off an infection. It is well known that blood cancers like leukemia and lymphoma make people very tired, and this tiredness is often worst in the morning, when the body should be feeling refreshed. These cancers make it hard for the body to make healthy red blood cells. This can cause anemia, which is a major cause of feeling tired all the time. But not only blood cancers can cause systemic inflammation, lung cancer, liver cancer, and colon cancer can too. This can mess up sleep cycles and make you feel very tired all the time. A lot of people think that being tired in the morning is just a normal part of getting older. But if that tiredness lasts for weeks and is accompanied by other signs like feeling dizzy, losing your appetite, or losing or gaining weight without a clear reason, it's a red flag. This is George, a 74-year-old man who loves going for a walk in the morning. No matter how early he went to bed, he started to feel exhausted when he woke up. It seemed like old age was catching up with him at first, but it got worse over the next few weeks. It was hard to do even small things like making breakfast. He went to the doctor and found out he had leukemia that had not been diagnosed yet. This was really draining his energy. Treatment worked much better because he caught it early. He feels stronger now than he has in years. You should pay attention if you wake up every morning feeling tired, even after a full night's sleep. Take note of any other strange symptoms and how long the tiredness lasts. Then talk to your doctor. If you feel tired all the time, it could be one of the first signs that something serious is going on below the surface. Third, morning sweats that you can't explain that make you drenched. At first, waking up drenched in sweat might not seem like a big deal. Lots of people think it's just a reaction to warm rooms or thick blankets. Some people have night sweats that soak their sheets even when the room is cool. This could be a sign of a deeper problem. Doctors warn that persistent morning sweats that can't be explained could be a sign of cancer, especially if they happen along with other symptoms. Some types of cancer, like lymphoma, leukemia, and some hormone-related cancers, can make you sweat a lot. This happens because cancer changes the immune system, which leads to swelling and problems with controlling body temperature. As the body tries to fight off what it sees as a threat, when the immune system is constantly activated, fevers and night sweats can result. A lot of people don't know this, though. These sweats are often not noticed until they get really bad. A lot of people don't think much of them or put the blame on getting older, stress, or menopause. But what makes night sweats caused by cancer different is how bad they are. They're not just light sweating, and they soak you through, so you have to change your clothes or even your bed several times a week. Take the case of Richard, a retired teacher who is 71 years old. For a while, he didn't give his night sweats much thought until they started happening every night. He would feel wet when he woke up and sometimes had to dry off with a towel before getting out of bed. He thought it was just part of getting older at first and put the blame on his age. He decided to see his doctor, though, when he started to lose weight and feel very tired. He was found to have lymphoma after the test. It made a big difference in his treatment and recovery that they caught it early. If you have morning sweats often and can't figure out why, especially if they soak through your pajamas or sheets, you shouldn't ignore the problem. Write down how often they happen and whether you lose weight or feel tired during them. Then talk to your doctor about it. It could be your body's way of telling you something is wrong before you notice else. 4. Weight loss in the morning that you can't explain. If you wake up and your clothes feel looser or step on the scale and see that the numbers have dropped without you trying to, it might not seem like a big deal at first. But doctors warn that weight loss that can't be explained, especially in the morning, can be one of the first and scariest signs of cancer. Even when you sleep, your body is still burning calories. Many times, though, rapid weight loss that wasn't planned is a sign that the body is using energy in ways it shouldn't, like fighting off a disease that is spreading. People who lose a lot of weight quickly are more likely to get pancreatic cancer. The pancreas is an important part of digestion because it makes enzymes that help break down food. When cancer is present, the body's ability to absorb nutrients decreases. This makes you feel weak when you wake up and makes you lose weight and muscle. In the same way, stomach and colon cancers can mess up the way the body breaks down food, which can lead to big changes in metabolism. But weight loss isn't just caused by cancers of the digestive tract. Cytokines are inflammatory chemicals that can be released by lung cancer, lymphoma, and even advanced prostate cancer. They speed up metabolism and break down fat and muscle. If your weight drops by more than 5% in a few weeks without you dieting or working out, you need to do something about it. A lot of people think that losing weight is a normal part of getting older, but doctors stress that you should never ignore sudden, unplanned weight loss, especially if you notice it in the morning. Take Richard, a retired 72-year-old man who always stayed the same weight. He saw that his belt was less tight one morning. At first, he didn't think much of it because he thought it was just a normal change. But over the next month, he lost almost 15 pounds without changing what he ate. He went to the doctor and got more tests, which showed that he had stomach cancer in its early stages. He was able to get better treatment because he caught it early, and he's doing well now. His story is a strong reminder that these little things you do in the morning can help you catch something big early. Write down the number of pounds you've lost recently without trying. This is especially important if you notice it first thing in the morning before you eat. It might make a big difference if you write down your weight and talk to your doctor about it. Last words, most important lessons learned, and next steps. To sum up, the 4 morning symptoms that could point to a serious health problem, especially cancer, are weight loss that you can't explain, blood and urine in your urine, pain that won't go away, being tired all the time, and a persistent cough or hoarseness. You shouldn't ignore these symptoms, and it's very important to see a doctor if they get worse or don't go away. Early detection is important for many types of cancer because it improves outcomes. It can make a big difference if you take charge of any changes in your health. It's important to remember that these symptoms don't always mean you have cancer, but they can be warning signs that you should see a doctor. When something is wrong with our bodies, they often let us know. Paying attention to these signs can help us catch diseases early, before they get too bad. Regular checkups with a doctor and being aware of symptoms can be very helpful for older people in avoiding or managing health problems. You shouldn't just avoid getting sick by taking care of your health. To make the best decisions for your health, you need to know what's going on. If you're worried about any of the symptoms we talked about today, you should make an appointment to see your doctor. They can help you figure out what to do next and get the right diagnosis and treatment if you need it. Do not forget that you should spend money on your health. Do not wait for things to get worse. Thanks for being here today. Please get in touch with us. Tell us what you learned today and how you're going to use it in your life in the comments below. We care about what you think, so don't be shy about telling us. We feel very motivated and encouraged when we read your comments. Please like, subscribe, and share this video if you liked it and found it useful. Thanks for your support. It lets us keep making good content for you to learn from and be inspired by. Thanks for watching. See you in the next video.